Acne is been a most common problem amongst the teenagers as well as the adults, both in males and females. Though it is a very common problem, yet we are very less understood about these things. We are confused with their daily routines. We do not know the type of acne we have, and we do not know how to manage it. Today, we are with Dr. Rashi, who is a dermatologist and also who's skilled in treating acne cases.
Like you said, I'm Dr. Rashi Soni, dermatologist, specially experienced in all the field related to acne and acne surgery.
Right.
So let's have a good chat about what we can do to prevent it so that the younger generation will at least not come to us with the big scars.
Teenage is a tricky age for both parents and children. They tend to develop new acne on the face and they do not know what to do about it. And they're worried much amongst themselves. Right? How do you think that they should act immediately as soon as they see acne on their face?
Acne is something which is how much is beyond the skin is underneath the skin. So people do not understand this and they usually wait till the scar is formed and then they come to us, which is actually very late because as a dermatologist, we can treat most of the scars, but it is not 100% going to go. So it is important, at least in the cases of acne, that we start early or we tell our teens to not to scratch it so that they don't leave the pigmentation and scars to it. But before we dive into all this, how do we get it? Let's understand the cause. So there are multiple things that can cause acne, starting
Right.
from our lifestyle,
Right.
the food choices we have, the sleep cycle, everything is directly linked to acne, even the stress levels. So say suppose we are chronically stressed, our cortisol levels are going up, and then there are cortisol releasing hormones that has to bring down, and it has that all cycle activated of progesterone, estrogen, and then the most important thing or the first thing to pop up is acne.
Right.
So as soon as we are having any big day, why do you think the pimple pops out? Because that's the time where we are most stressed about. So these are the few things we have to take care. I get that if I'm saying you don't be stressed, it is not possible that you don't be stressed. But as much as possible, we can take it forward. We can inculcate good things. It is actually what you eat shows up on your face also. So that's
Right.
one most important thing. Now, see, suppose if you're doing everything right and still getting acne, so we cannot deny that there is not a genetic association or predisposition to acne. So even if your food is healthy, diet, exercise, you're doing everything in time, yoga, meditation, you can still get acne. But
Right.
then you always have to keep in mind that there are treatments, there are modalities, which if you take the treatment properly and wisely and with the experts like us, it is always better that we are not going to damage their skin more.
And it is also important to keep up their morale and then the confidence, doctor. Lot of kids, they tend to lose confidence and they assume that it's going to be like that, and no matter how many doctors they visit, they come to the conclusion that the treatment is not that well effective or that not working, and they keep changing the doctors but they do not follow the prescribed routine.
Right.
How important it is to follow a acne routine.
It's utmost important. One thing here to understand is that this is not going to go overnight. We have to treat all the clogged pores, sebaceous glands which are attached to the inflammation, propionibacterium acne. This is the bacteria and overproducing glands. We have to treat it at the root. So it is important to take that 4 to 6 months of proper treatment so that at least it is not recurring.
Right.
And one thing you also have to keep in mind that you are not alone. Everyone is facing acne. We have the million billion population in the world and millions of people have acne. This is the most common complaint, yet it is most difficult to tackle. So if you are having any confidence issues or something, because obviously it's on your face, it is going to have a toll on your mental health. But you have to know that you are not alone in this. There are treatments. Go out and seek for them.
So also I think that not one routine suits all kinds of skin, doctor.
Right.
And acne per se, it has its types, right?
Yeah.
And the treatment modalities differ from one type to another type.
Correct. As rightly as said, one size doesn't fit all. So when there are types of acne, the first stage is where you just have those comedones, like white comedones, closed comedones, open comedones. That is one thing, wherein you can just apply some topical creams that you can get over the counter, as well as prescription medications are
Right.
there, like salicylic acid or tretinoin you can use. If it is stage 2 where there are multiple papules and few pustules, in these cases only the tretinoin is not going to help. You are supposed to add something which has antibacterial action, say for example clindamycin. Now, moving on to the third stage, if you're not treating stage 1 and stage 2, it is a definitive chance that the clogged pores is inflaming inside the skin and giving you the more nodulocystic acne.
Right.
Okay, so the third stage is where this nodules are more and the pustules are more. So in this case, it is at most important you start the oral medications like doxycycline, isotretinoin, depending upon seeking the best professional advice. And this has to be strictly done under a dermatologist guidance only. So the fourth stage is where you come up with multiple scars and nodulocysts. So in this stage, then the procedures come into picture. Like black peel is there, salicylic mandelic peel are there, micro needling, MNRF, radio frequency ablations, subcision, acne scar surgeries. So this can go, but this has to be done after the active acne has subsided. Any which ways, you have to understand here that the treatment is going to be first few months oral or topical to subside it, and then we can combine this procedure to get you that beautiful result. And the utmost important thing that works for scars is CO2 lasers and MNRF. Hi, I'm Dr. Rashi Soni. I have done my MBBS and post graduation in dermatology from MGM Medical Sciences, Navi Mumbai. I am also specialized in facial aesthetics, fellowship done in Mumbai, hair transplant fellowship also done in Mumbai. I have also been mastered in observership with dermatosurgery and lasers with IADVL. You name it in dermatology and I have done it. My experiences are in hair transplant, Botox, fillers and mainly non-surgical facelifts. We at Vivace Aesthetic Clinics, Road number 10, Jubilee Hills, give you the most up-to-date transformations, be it for your skin or for your hair. So if your problems are related to any of the hair journey or skin journey, please feel free to book us. We provide the most advanced technology in the field of anti-aging medicine. So do not hesitate and transform your skin.
Most of the people, they think that if they have oily skin, they should not use any moisturizers. So do you advise moisturizers? What do you think? What's your take on it?
Yeah, so this is the most common misconception, and I usually tell my patients it's not like that. Moisturizer is for all skin types.
Right.
There are different types of moisturizer, gel based, lotion based, cream based. So if you have oily skin, you can always opt for the gel based moisturizer to give
Right.
you that effect. And also, if you have acne, one common myth is that people exfoliate their skin a lot or scrub their skin a lot, assuming that it will treat, but it doesn't treat. It is just going to increase their inflammation more, and they'll tomorrow come to us with more acne, and then we'll have to treat them all. Treating is not absolutely a problem, but if they're educated well, this is something which they can avoid.
Yes, preventive medicine always acts a major
Correct.
role than going rounds and rounds of worrisome treatments. It's always better to follow simple routine in the beginning,
Right.
from the beginning itself.
Yes.
Also, a lot of people tend to complain, well, a lot of our patients tend to complain that, they have acne and then there's a lot of dandruff
Yeah.
in the scalp. And then, is there any link between acne in patients who are suffering from acne? Also, tend to have seborrheic dermatitis, and is there any link between the hair dandruff to that of the acne?
Yes, it is directly linked because see, when you're getting acne, the inflammation is around the sebaceous gland. When you're getting dandruff, that is also due to the overproduction of oils through sebaceous gland. So there is a hair structure that is attached to this sebaceous gland, which
Right.
is overproducing and forming acne as well as dandruff. That is why the most people who have dandruff tend to have back acne or body acne.
Also known as acne nowadays. Yeah.
Nowadays with all this Instagram knowledge,
Right.
yeah, it's directly related. But if they have acne, then the most common thing to do is apply benzoyl peroxide. There are foaming or lotions. If
And salicylic acid
yes,
washes,
yes,
and benzoyl peroxide washes, as you said, is it?
yes.
Yeah.
So this is one thing that can be done at home. If people are coming to with one or two pimple, or they do not have a lot of things, then maybe they can use to stick to a routine where they are following just AM/PM routines. Like they are inculcating BHAs like salicylic acid in the AM routine. They are using salicylic acid based face washes, and they are applying some moisturizers which are non-comedogenic, paraben free. These are the ingredients or list they can look at, so that they don't purge out or they do not break out. And at the night time also, like I said, gel based moisturizer is a must. Also, if you have acne, then also sunscreen you have to apply.
Right. A lot of people tend to skip sunscreens, tend to skip moisturizers, and the skin becomes dry in some areas, and they tend to develop breakouts again
Correct,
in
correct.
return. And how come the winter accelerates acne? Do you accept or do you deny it?
It's actually not winter that accepts the acne. Winter is something which will break out more into rashes or dry skin, not acne. There are multiple different triggers, like winter can cause exacerbation to dandruff. Dandruff can then cause exacerbation to acne.
Acne, yeah.
That can happen, but no, as such, no direct link.
So let's speak about acne in adults, doctor. A lot of people, though rosacea is little less in our country, still we have rosacea, which has like a redness around the nose and around the cheeks,
Right.
right? So how this kind of a rosacea is directly linked to acne kind of a skin, or like it itself is a separate condition?
Rosacea is completely separate. It's actually misdiagnosed as a condition which is acne. That is why they don't get result. So people consider here, at least in India, because they are not aware a lot, but they are two different conditions. The etiology is also quite different. So the treatments are also quite different. Few things
Right.
are obviously similar, but you need to understand rosacea. There are particular do's and don'ts wherein you will have to avoid hot things, cold coffees, caffeines, lots of caffeines because of all the flushing. Acne, you are more avoiding the dairy, like the milk, high glycemic index food, so that you don't pop out. And like you said, people have this misconception that acne is the adolescent problem. It is actually not. It can be seen in any ages, right from perimenopausal women also. This is mainly due to hormonal imbalance that they get acne.
Right.
And in adolescence also, people break out a lot due to our lifestyle these days. We are running, stressing out about a lot of things, and everything is related to directly to hormonal imbalances. Thus, everything is related to acne in the end.
And also the treatment protocol quite changes between male pattern of acne and then female pattern of acne, right, doctor?
Right, yes. Because females have something in addition, usually, like they have some kind of PCOS or hormonal imbalances that needs to be corrected. So when we are treating female, it is usually something hormonal supplements or replacement that needs to be given. With males, they have more tendency to form scars. So the vitamin A derivative fits better for them. For female, it depends on the age, reproductive age, because we cannot give them certain things if the female is of a reproductive age, and if she has been developing this constantly while menstruating or due to PCOS, then the line of treatment has to be completely changed and the root cause has to be treated.
And for the patients who usually come to our clinics, as you know that you've encountered many times that they would not go want to use any kind of medicines, but then they are willing to do these peels. How effective are these peels? We usually see very good results with black peel, salicylic acid peels, and then salicylic with mandelic acid peels. Within just one or two sittings, there's a definite change in the acne. So, do you too believe in peels, and then do you recommend these peels to all kinds of people associated with acne?
I do believe in peels. They work wonderfully, and as if you want any faster results, nothing better than that. But it cannot be given to all types of acne. If the acne is very active, if it is in the third or fourth stage, then peel is not the first choice of treatment we should give. We should correct the underlying inflammation and then we can go ahead with peel. But if it is, then there are stages, and differently, like glycolic acid works best for the comedonal acne glycolic peel. If it is stage 2 3 acne, then like you said, black peel works the best, and the results are absolutely great. No downtime is also required. It's like a lunchtime procedure, so you just come quickly, get your skin done, and you can just walk out of the clinic.
Right. And I also I have seen you suggesting our patients 5 or 6 sessions of chemical
Yes,
peels.
yes.
Do you recommend more than that if the patient is so used to peels? Do you recommend more than that, or you would like to give some break to them?
I usually do not recommend more than that because skin is very well balanced. If that after that the maintenance is needed, maintenance can be done by some creams like BPO, that is benzoyl peroxide, or tretinoin at home weekly once, or some mild exfoliation at home that can be done.
Mhm.
But if still the patient is breaking out a lot, every 3 monthly or 6 monthly can be added for a patient satisfaction.
Right, right. So you have given wonderful explanations and
Thank you.
insights in the this subject, especially acne, where people have many queries and myths. They can always contact you and consult you at Vivasha Aesthetic Clinic. Thank you very much, Dr. Rashi, for your time and the information you've given. You busted many of the common myths among the teenagers and adults as well, and also the insights about acne, and then following the proper acne routine. That's what not commonly known. Thank you so much.
Thank you.
Anybody for further queries and consultations with Dr. Rashi, please contact the given number.